Good afternoon, and thank you for joining us. Today is Tuesday, February 15th, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Thank you all for being here, and Mayor Johnson, I'll hand things over to you to get us started today.
Great. Thank you so much, Catherine. And good afternoon, everyone. Today, I've got some great news to share as I provide an update on our COVID-19 gating metrics for this week. We've now dropped from the extreme to high transmission category for COVID-19 cases per 100,000, down to 144.2 cases per 100,000. Our COVID-19 cases per 100,000 have not dropped to the high transmission category and under 150 mark since November 4th of last year. That's over 3 months ago. And our percent positivity rate has dropped from the substantial to moderate transmission category, now at 7.1%. Our percent positivity rate has not dropped to the moderate transmission category and the 7% mark since November 18th of last year, just before the Thanksgiving holiday. On vaccination rates, 62.7% of City of Milwaukee adults, those are individuals 16 years of age or older, are fully vaccinated. 68% of adults have received at least one dose, and 44.3% are fully vaccinated with a booster. It's relieving, I think, to see our case numbers continue to fall again this week, putting us back in line with the disease burden rates that we saw just before the Thanksgiving and Christmas holidays. While I'm happy about this improvement, I'm disappointed still to see that our vaccine metric continues to move far too slowly. This week, our vaccination rate increased by just about 0.1% from 62.6% to 62.7%. So we got to do better than this. Vaccine remains our community's best protection against COVID-19. For clinics, the City of Milwaukee is committed to engaging residents who have not yet been vaccinated through its mobile vaccination clinics. The Milwaukee Health Department continues its partnership with Milwaukee Public Schools to provide vaccines to students, to staff, and to the community through mobile clinics until February 29th. Now in its second round of school-based clinics, the Health Department has administered nearly 660 doses of vaccine since these clinics began. Again, I want to remind all members of the public that these clinics are not just for students and staff in schools, but they're open to all the members of the community to take full advantage of. Here's a summary of the mobile vaccination clinics for this week. So today, February 15th, from 2 to 5 p.m. at Hayes Bilingual School. Tomorrow, February 16th, 10 a.m. until 2 p.m. at UW Milwaukee Union, 1 to 4 at Ascension All Saints Family Health Center. Thursday, February 17th, 2 to 5 p.m. at Rocket Ship Southside Community Prep. And on Friday, February 18th, 1 o'clock until 4 o'clock at Our Avenue School. Vaccines and boosters are always available at the Health Department's community locations at the Northwest, Southside, and Menominee Valley sites. A schedule of all clinics is available online at milwaukee.gov/COVIDVax. Finally, I want to share that the Milwaukee Election Commission has mobilized a lot of people throughout the city for the primary election today. COVID-19 safety precautions are top of mind at the polls where masks and social distancing are in place. In addition, there is a regular system of cleaning voting booths in place. Hand sanitizer is also available to voters too. I want to express my appreciation to the workers at all the wards and at Central Count for their willingness to serve. I encourage every eligible person to vote. The polls are open until 8 p.m. tonight. And with that, I think I pass it over to Dr. Ben Weston.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 190 new cases per day and about 3 deaths per day. Next, on a quick note, in our continued efforts to make masks more accessible to our residents in the county, the Milwaukee County Department of Health and Human Services is distributing free N95 masks now through Friday, or as long as supplies last. So you can pick up masks on the 3rd floor of the Marcia Coggs Center. That's at 1200 West Vliet Street. And that's between 8 a.m. and 3:30 p.m. Over the last several weeks, Milwaukee County has distributed more than 400,000 masks to local community partners and suburban health departments. And as I'll talk about, these high quality masks are critical in our fight against COVID. Onto our trends, we're seeing encouraging declines in cases, hospitalizations, and deaths. Now, our positivity rate remains high at about 9%, but that number too continues to decrease rapidly. And as we see these promising trends, we also hear the discussions beginning on pulling back mitigation measures, masking, distancing, capacity limits in schools, businesses, as well as counties and states. Now, we all want to return to normal. We all want the pandemic to be over, but are we ready to loosen up? I think we're close, but we must keep several important considerations in mind. First, though our trends are moving in the right direction, our disease burden remains high. Nearly 2,000 daily cases in Wisconsin, over 1,000 COVID patients still hospitalized, and still 16 deaths per day. Now, at most other points in the pandemic, each of those numbers would be near record-breaking on their own. Now, to be sure, they're all declining, but we should take caution in being too quick to pull back. Second, we have the BA.2 variant to consider. It appears more transmissible than the original Omicron variant, but equally severe, and now likely around 10% of cases in the country. It's unclear what effect this may have on our trajectory. Nonetheless, that trajectory is promising. So this is really a variant to monitor at this point. But third, we must remember that not all of our population is protected from COVID. Those under 5 years of age still await authorization of a vaccine. Now, we had the momentary hope of a vaccine coming in weeks, squashed last week on Friday with news that the initial data from 2 doses did not justify authorization, and a 3rd dose would be evaluated before further action would occur. Now, this is science at work, and science is not always simple, but it is nonetheless a frustrating setback for many parents and families awaiting that vaccine. And along with those young, unprotected kids, we have 7 million immunocompromised people in this country. People who look just like you or me, but are not able to get the same level of protection from the vaccine and remain vulnerable when disease burdens are high. And speaking of vulnerable, there are the socially, racially, and ethnically vulnerable populations that continue to face barriers and misinformation to vaccination, and are particularly susceptible to poor outcomes when disease burden is high. Now, for each of these reasons, high disease burden despite promising trends, a new variant brewing, and unprotected populations, we should be cautious as we look to pull back mitigation measures. Now, let's be clear, we will not mask and distance forever, and better days are certainly to come. But as we determine our path forward, that path should be guided by metrics, should be informed by experts, and focused on equity. Guided by metrics, informed by experts, and focused on equity. We don't need to go from 0 to 60 all at once. If we've learned anything over the last 2 years, we should proceed with caution. And remember, each of our communities in Milwaukee County has public health officers, leaders who've spent most of their waking and likely their sleeping lives over the last 2 years thinking about how best to keep their community safe. So use these folks, trust them, and engage them in these discussions as we move forward. Thank you and stay safe. And I'll hand it off to one of those health officers who I'm sure has lost more than a night or 2 of sleep over the pandemic, Darren Roush.
Thank you very much, Dr. Weston. It's my pleasure to join you today. Just wanted to start today with some epidemiological data updates, just to really drive home in some figures and graphics, some of the data that you've heard Dr. Weston and Mayor Johnson describe already. Like my predecessors said, we're making some good progress, but still there's a little bit of ways to go in moving COVID out of our communities. So with that, we'll start here. This is the Milwaukee County daily number of COVID cases. And again, just to reflect what others have said, we are seeing rates at this point that we haven't seen since early November. So much improvement has been made since those early peaks in late December, early January, but certainly we still have a long ways to go. Most counties statewide are reflecting critically high rates, although most of southeastern Wisconsin is only in the very high category, which symbolizes that we're moving in a downward direction with our trajectory. When we look at cases in kids, we're seeing very similar positive trends. We're seeing, again, rates that we haven't seen since early November, late October. Again, very, very promising. And something that Dr. Weston had mentioned that I really want to reflect on this slide is looking at the shift in COVID over the last 24 months. We know in the early days of COVID, a lot of cases were centered in the central city, and then the next wave of cases occurred in the south side with a lot of occupational related cases at workplaces across the area. But really, since then, we've seen cases explode throughout the county. And more recently, we're seeing on the right-hand side of the screen, we're seeing a lot more cases in the suburban communities than the city of Milwaukee proper. And this has been a trajectory that we've been watching for several months. So on the left side, we're seeing total incidents since March of 2020. On the right side, we're looking at just the last 2 weeks. And again, just want to underscore here the reflecting changes in COVID-19. And we've seen that both across race and ethnicity, we've seen that both across age groups, and it plays out both in cases as well as in vaccination as well. Again, we can look at this figure by kids, and this is what this graphic is doing here. On the right is kid cases under the age of 18 in the most recent 2 weeks, and on the left is the total. And again, it reflects a lot more cases in the suburban communities in the city of Milwaukee at this point. Again, underscoring that we've seen a lot of differences and a lot of changes in disease. We see the same thing happening in vaccines over time as well. We've been giving vaccines in Milwaukee County since early December 2020. In the early months, a lot of primary vaccine series, first and second doses, followed by booster doses. And then more recently, that third vaccine, primarily that booster dose is dominating. Although we are seeing, particularly when we look at this next slide, the additional Pfizer doses for 5 to 11-year-olds. And again here, primarily early on, a lot of doses going to adults, Pfizer, Moderna, Johnson & Johnson, now more recently, Pfizer vaccine for kids 5 to 11, which has really been predominantly our focus in addition to boosters across Milwaukee County. So not just vaccines here at local health departments, but vaccines at clinics, pharmacies, and other outreach centers throughout the county. Now, with the vaccines, we still continue to see disparities in who is getting vaccinated. So this particular slide shows the percent of residents that have been completely vaccinated with any COVID-19 vaccine, and this is looking at age. So here we can see that we have high percent vaccinated in our older adult populations, but we're still lagging a little bit in our 5 to 11s, which have only been eligible for the last 3 months or so, but we're only slightly above 20% as far as 5 to 11-year-olds countywide completely vaccinated. About 33%, or about a third of the 5 to 11-year-olds have received at least one dose. So we're moving in a positive direction, but certainly we'd like that number to be higher. All of the other age groups at this point are reflecting that complete vaccination at higher than 50%, which is really good. Now, again, when we talk about disparities, we look at race and ethnicity here in Milwaukee County, and we see some differences. We see the Black or African American line for fully vaccinated. That population group is only being vaccinated about 41 or 42%. So again, we've got a little bit more work to do there in comparison to some of our other more highly vaccinated race and ethnicity population subgroups that are up in the 70% range. So again, this is something that we need to continue to focus on, is equalizing vaccine for all, pushing vaccine out to all of our communities that need it, and really doing our best to get everybody their primary series and their booster. And so we're oftentimes asked about where to find the best sources of information. And again, we've talked about that before here on these briefings. We know that information is available at our fingertips through a whole range of sources, from the internet to social media, et cetera. But I want to continue to remind, as Dr. Weston has and others, that your trusted sources of health information is healthymke.com. That is a site that myself and colleagues throughout the county association with other partners countywide put up that talks about COVID disease and COVID vaccinations. And again, I'll underscore your family physician, your family doctor, a pediatrician for your kids. These experts, including other trusted healthcare workers like a nurse from a community clinic or a pharmacist, these individuals have studied vaccines, have studied healthcare, and if you can trust them for your diabetes, your high blood pressure, other treatments that you may get or receive, you can also trust these folks for honest, factual, science-based information related to COVID-19 and related to COVID-19 vaccinations. Throughout the pandemic, there's been way too much misinformation and disinformation, and this has been a very significant challenge for public health officials and for medical practitioners as well. Misinformation is defined as incorrect or misleading statements that are often spread unknowingly. Disinformation, on the other hand, describes deliberate false statements and mistruths. And quite frankly, both misinformation and disinformation have been very problematic to our COVID-19 response, and it's very harmful for our public health response and harmful for our communities who really need to get vaccinated and learn about ways to keep themselves and their families safe from COVID-19. So with that, I will turn it over to Catherine for the Q&A portion. Thank you.
And thank you, Director Rausch. We do not have any questions in our chat at this time, so I'll just give it a few minutes. Again, if you have any questions for our speakers, please put them in the chat or raise your hand and let me know you'd like to ask your question. I'll give it just 2 minutes, otherwise we will conclude the briefing. All right, seeing that there are no questions, thank you all for joining us, and we will see you next week.
Thank you.